Seen ultrasound on a neonate in a coronal view shows the line hyperreflective dots are seen on the lateral ventricles, which are found in most likely diagnosis. Congenital cytomegalovirus infection. Now, line of hyperreflective dots in the lateral ventricle, periventricular region. No dots in the periventricular region, cytomegalovirus infection. The periventricular toxoplasmosis is widespread. Okay, congenital cytomegalovirus has periventricular calcification or highly refractive dots, and toxoplasmosis has widespread dots. Toxoplasmosis high widespread dots, and cytomegalovirus periventricular calcification or white dots. Toxoplasmosis widespread dots. Next, question 57. A 6-month-old girl with a repaired meningoencephalocele at birth and hydrocephalus and MRI scan to check the position of her VP shunt. Several T1 and T2 images demonstrate a small posterior fossa with tactile beaking and a cervicomedullary shrink. What finding in the cervical spine would account for any recent onset of neurological symptoms? Stringomelia. This diagnosis of Chiari malformation. So there's a small posterior fossa and tactile beaking. What finding in cervical spine would account for any recent neurological symptoms? Stringomelia. So usually there's also seen stringomelia in Chiari. So there's tactile beaking, there's small posterior fossa, and there's meningoencephalocele. Question number 58. This is Danny-Walker malformation. MRI of the tragus spine in a 26-year-old shows multi-level anterior vertebral body scalloping. Therefore, it is likely to be a cause Down syndrome. Now, anterior vertebral scalloping is seen in Down syndrome. Anterior vertebral body scalloping is seen in Down syndrome. In Marquis syndrome, there's posterior vertebral body scalloping is seen in Marquis syndrome. Question 59. Infective spondylitis. Which feature was inspected on MRI? Narrowing of disc space with high signal in the adjacent vertebral bodies on T2 weighted images. Infection is narrow and fat is so high T2 and adjacent tissue. Infective spondylitis. What feature would expect on MRI? Narrowing of disc space with high signal in the adjacent vertebral bodies on T2 weighted images. Infection makes the disc space narrow, and in adjacent tissues there's high signal and adjacent vertebral bodies on T2 weighted images because of the fat and edema. So infective spondylitis has narrowing of disc space. Question 60. MRI shows widening of the spinal canal with posterior vertebral body scalloping between T3 and T7. On T1 and T2 weighted images, a well-defined high signal mass was present in the anterior to the spinal cord with atrophy of the cord at this level. Well-defined high signal intensity mass anterior to the spinal cord with atrophy of the spinal cord at this level. The CFS space was slightly expanded immediately superior to the mass. No high signal was present in the cord on T2, most likely diagnosed neurogenic cyst. Well-defined high signal. So there's widening of the spinal canal with posterior vertebral body scalloping, and on T2 there was well-defined high signal intensity mass with anterior to the spinal cord with atrophy of the cord at this level. The CSS space was slightly expanded, diagnosed neurogenic cyst. Question 61. MRI shows gibbous deformity centered at T10. Destructive change was seen involving both the anterior and posterior elements above and below this level, loss of vertebral body and intervertebral height. The epidural abscess was seen tracking down to L1. Epidural abscess is also used to be seen tracking down to L1. Most likely diagnosed tuberculosis. Gibbous deformity plus epidural abscess diagnosed tuberculosis. Question 62. Surgery for herniated L4, L5 disc material. MRI shows extradural soft tissue mass within the spinal canal with demonstrated enhancement for contrast. Nerve root enhancement was striking, most likely diagnosed radial disc material. Surgery for herniated disc L4, L5 level. And MRI shows extradural soft tissue material within the spinal canal which demonstrated little enhancement for contrast. So diagnosis radial disc material. This is post surgery and there's a soft tissue material within the spinal canal which demonstrated little enhancement. Next question number 63. This scan T10 vertebral body. This demonstrates some expansion with internal lucencies and areas of coarse calcification. The posterior element was spared. X-ray of the cervical spine shows vertical striation, which is diagnosed hemangioma. When X-ray of the spine shows vertical striation, then most likely diagnosed hemangioma. And there are no malignant features. Question 64. Nuanced spondylolysis. At 50% spondylolisthesis, patient had new onset lower limb weakness, had an episode of vertigo 6 months previously. MRI shows spondylolisthesis is found to be stable. What would be the next investigation would you would suggest? MRI brain. Where spine is stable plus episodic weakness. Patient has don't paralysis and pre-parent paralysis and new onset lower limb weakness and have an episode of vertigo. But his MRI spine was normal. So we would again do MRI brain because patient has episode of weakness and spine is stable, so we'll do MRI brain to see any lesion in the brain. Question number 56, 65. Diagnosis of Cable field syndrome, which of the following would not be an expected feature? Paravertebral ossification. This paravertebral ossification is seen in dish, is not seen in Cable field syndrome. Diagnosis of Cable field syndrome, which of the following would not be an expected feature? Paravertebral ossification. Question number 66. Span X-rays followed by CT scan show the flowing calcification ossification along the right anterior aspect of T7 to T9 vertebral body, most likely diagnosed diffuse idiopathic skeletal hyperostosis. This on CT scan there is fluid calcification and ossification along the right anterior aspect of T7 to T11 vertebral body, most likely diagnosed diffuse idiopathic skeletal hyperostosis. Question number 67. MR vertebral spine shows multiple tortuous tube with signal void on the posterior aspect of the corda cana was visible on both T1 and T2 images. Subtle bumps were seen along the surface of the cord. The corner was expanded with a high signal within it on T2, most likely diagnosed spinal dual arteriovenous fistula. Look here, it's referring this MRI subtle spine shows multiple tortuous dual arteriovenous fistula. Okay, the MRI cervical spine shows multiple tortuous tube like signal voids on a posterior aspect of the corda cana on both on T1 and T2, and subtle bumps were seen along the surface of the cord. Subtle bumps on the surface of the cord, and a corner was expanded, most likely diagnosed spinal dual arteriovenous fistula. Question number 68. The spinal arteriovenous malformation. As you cannot see the vein, you can only see a single artery. There are no vessels coming from above. In arteriovenous fistula, there are also vessels coming from above and below. Question number 68. Left retroorbital pain and double vision. Left 3, 4, and 6 nerve palsies. Imaging abnormalities in the ipsilateral cavernous sinus and superior orbital fissure. Most likely diagnosed dorsal hand syndrome. Dorsal hand syndrome is an idiopathic inflammatory condition that involves the cavernous sinus and orbital apex and is essentially a clinical diagnosis exclusion. It is an inflammatory condition that involves the cavernous sinus and orbital apex. So, left orbital pain and double vision, left 3, 4, and 6 nerve palsies, imaging abnormalities in ipsilateral cavernous sinus and superior orbital fissure, most likely diagnosis dorsal hand syndrome. Question 69. MRI scan of his brain shows a ring enhancing lesion. What MRI period clears this lesion to be a metastasized rather than abscess? Uniform knee thickening enhancing wall. Which MRI feature would favor this lesion being metastasized rather than abscess? Uniformly thick enhancing wall. Question 70. HIV encephalitis. Which region of our brain is most likely to be involved in this on an MRI scan? White matter of central somnio veil. Now in herpes encephalitis, temporal lobe the high signal on T2. But in HIV encephalitis, the white matter of central somnio veil is involved. On HIV encephalitis, white matter of central somnio veil is involved. ठीक है बस?
जी सर बस.
ठीक है खुदा हाफिज़.
अल्लाह हाफिज़.